I mean, because we kind of preach like individualization.
Yes.
So what methods do you use to customize for a client? What tools, what do you assess? Just checking my stuff here. You guys are good.
Yeah, I think the first thing is always, whenever I do work with a client, and to be perfectly frank, I really don't do much work with end users anymore. Now I work mostly with trainers themselves, working on them, trying to help them build their businesses, and also trying to help them become better practitioners as trainers. But what I preach for the most part is really look at the individual, establish what they want. So I'll take a really simple approach. I try to be very, very simple, just to keep it easy. I get body comps, and then I build I build nutritional plans around the macros, around their body composition and the application of macros. Carb cycling is pretty straightforward. That's the simplest way that I found, and it's for most people it's really easy to follow. And then I especially if it's the first time working with someone, I don't know how they're going to respond, so we try. And if I work with them again, hey, do you want to try this? Try this. It works a little better. This is also why I tend to work over longer periods of time with clients, because I like to have the option of maybe shifting gears at some point earlier on, as opposed to only giving myself 12 weeks, in which case, okay, we started this, we're going to finish this.
Yeah.
Right? And then like forcing them through when they hate it.
Yeah.
If I can find something that's more comfortable for the client, that's so much the better.
What's your take on just doing it through diet versus supplementation? Whether you include protein powder or this and that. Like, what's your take?
I've done both personally. I've done both with supplements and without. I just find it's easier, particularly when you're larger, when you become a larger individual, and you're adhering to that, the ratio, the 1 gram per pound of body weight, or 1.5, as the case may be, depending. It's just easier to take to use supplements, especially a good supplement. If you can find something that's a good high quality protein, for example, definitely. It's more flexible, it's easier, more convenient. Again, people are working their jobs, they have things to do, they can't be
meal prepping constantly.
Yeah, and I remember doing it. My first contest, there was no supplements at all. Not even creatine, if I remember at the time. Any event, and it was all whole food sources. And I felt like such an ass walking around with the big cooler with the food, and in the middle of a meeting. Oh, it's mealtime, I gotta eat, and everybody's staring at me. And I remember feeling, oh, I'm special, I have to eat. But it's a little silly, right? Yeah. It's a little silly, as opposed to maybe just breaking out a bottle of water and or a pre-mixed protein shake and drinking that. Okay, I'm covered for now. It's
a little bit more casual.
And the idea again of the dogmatic thinking you have to eat every 3 hours. And it helps.
Sure.
Certainly when you're pulsing protein and you're taking that. But
how about waking up during the night?
Yeah, I've never been a fan of that. I just think disrupting your sleep to get up to go drink a protein shake.
Well, there's some people their output, their calorie burn is so high, they can't get enough calories during the day.
If you wake up, my feeling I've always said to people, if you wake up to go use the restroom or whatever, sure, because you're already awake.
Yeah.
But I'm not going to set an alarm to wake myself up at 4 a.m. to go have a protein shake.
Yeah.
And disrupt my my circadian rhythms and my sleep.
I think that's where it's going across the line of health.
Yes, and to obsession.
Yeah.
Right.
Yeah.
I remember a friend of mine, another bodybuilder, has a tattoo on his forearms. It's not an obsession; it's dedication, which I can appreciate. But there is a line, right? And I think if you're waking up at 4 a.m. to pound a protein shake,
it'd be funny if he did this with his arms.
Yeah, it's like, what am I reading here?
It just flips the meaning.
Yeah, dedication.
It's
not dedication. It's an obsession. Yeah. Oh man. Yeah. But I just think that just going too far sometimes. There's no need to go that far.
Yeah.
You don't need to. And again, keep in perspective. I always say, what are you going for? What's your intention? oh, I want to be a pro bodybuilder. Really? Do you really want to be a pro bodybuilder? Is that
no,
really
you
what this is about?
don't.
No, you really
Unless
don't.
you're like 17 and you look like, you should be.
Yeah,
you're not going
to be. But that said, you know what? I remember years ago being at a gym with a bunch of bodybuilders, and a young kid, 17-year-old kid, skinny kid, came up to us. Oh, I want to look like you guys. I want to be big, and I want to be a pro. And like, okay, kid, okay. That kid was Ben Pekulski. And he did it. And he's actually a great. We actually studied together, and we did a few courses together, and really smart guy, and he did it. So, who knows, right?
Well, I mean, I want people to train. I mean, I just want people to be realistic. So, like, what do you think is realistic? How often? What should be for the average person a good goal? Is it like how would you measure that? Would you measure it by first you gotta trim down, and that's probably cardio as much as weight training as well. And then what would be a healthy goal for the average adult?
Perfect. So again, I have this conversation daily, and so what I reckon, and there's a few reasons for it. There's some business reasons in terms of revenue generation, but there's also in terms of resultant for the individual. My general suggestion for most adult human beings is gain lean muscle tissue first. That's what I focus on. That should be your principal focus. How much? Well, it depends on your structure and your size and your age, but typically women 2-3 kilos, okay, in total. Men, maybe double that.
Yeah.
Okay. And I think those would be, and why I say that is that's enough of a muscular gain to make a profound difference in appearance, in function, in structural support, metabolic support as well. Okay. And I think that's a reasonable number to achieve, again, without tipping into that line of obsession.
Yeah.
Oh, I want to gain, 30 pounds of muscle. Okay, that's a lot. That's a heck of a lot. And that's going to take a very, very long time.
They don't realize that.
They don't realize that. No. But because, again, you've got, where do people get their information from nowadays?
Well, Instagram.
Not even. Instagram, YouTube. And granted, there are some wonderful people on there, but the vast majority are charlatans, conmen, and women.
Well, it's even just seeing it. Just you see the person like, I want to look like that.
Yeah.
And it's like, okay, but you don't know what goes into that, or you're about to find out.
Yeah.
And then that kind of is a filtering out process, because it's like either you really, really want it, or reality is you're not going to do that.
Not going to do it.
But that's like, I mean, you're saying like between men and women, 5 to 10 pounds of muscle, and I couldn't see like when we do body composition.
Great tool, by the way.
It's amazing. And it's like, if someone gains a pound of muscle, they're like, hey, look at me. I'm seeing changes. And we're not talking big numbers. We're not even saying necessarily the scale, the weight changes. It's just composition is changing.
And that's the key. So one of the biggest challenges I have, and something I spend the most time on when I'm speaking to end users, is I always say, if I could snap my fingers and give you the aspirational physique of any Instagram celebrity or any of these people, and I can't believe I just used the term Instagram celebrity. I think I'm going to wash my mouth out with soap now.
It's reality. It's okay.
I know. It's frustrating. Anyway.
The word celebrity is watered down now.
Instagram personality. How's that? We'll say that. Instagram personality, I say, if you can have that physique, that aspirational physique you want, but the scale doesn't change at all, or even goes up by a couple.
That's hard.
Are you okay would you be okay with that? Yeah, exactly. Now, men, for the most part, no problem.
Yeah, they don't.
Yeah, sure. Women, it's a bit of there's a bit of a, you know what? Yeah, I would.
Well, I felt good at 110.
Yes. And so I actually use a matrix where I break down weight, body fat, fat mass, and fat-free mass, and then I set a goal and I show them the differences and the delta, and that graphic is very helpful, helping people understand what their goal is and what's involved in getting there. So when someone says, "Oh, I want to lose 10 pounds," I'm like, "Okay, hold on. Is it 10 pounds? Let's do the math. Let's do the science. Let's break it down." okay, you're not losing 10 pounds. You're actually losing, 22 pounds of fat, but you're gaining 10 pounds of muscle. So the net difference is only 8, right? Or 12. I think I did that wrong. Anyway, the idea, right? So that's not a failure. That's a success. And we have shows. And we have The Biggest Loser was a massive blight to the industry when it came out and was so popular because it made everything about weight loss.
Yeah.
And I remember watching a clip. I've never watched a full episode because I couldn't get through it. Jillian Michaels made me crazy. America's best trainer. And then she switched it to toughest trainer. Then she said the toughest trainer. Okay, sure, you can be the toughest trainer. Go knock yourself out. No, literally, knock yourself out. Anyway, and she and there was a young fella who was working out and he was doing a lot of weight training. And his weight didn't change. Oh, you failed. No, but he dropped a whole bunch of fat, but he gained muscle. The kid
he was on the wrong show.
Exactly. And I found that, and you can see how again, I'm sure dramatic effect. The kid was dejected, but
they sent him home.
I honestly, I don't know. But the point is, other people would see that and say, oh, he, even after all that exercise that he was doing, he didn't lose any weight. Exercise doesn't work. What?
Yeah.
I've heard that.
It's sending the wrong message.
And this is what I mean about the industry needing to change. So to go back to your question most recently, some of the things coming through the evidence-based approaches, again, is this popularization, the greater the acceptance now of muscle building. For women in particular, it's huge. And I think that the acceptance, this notion of wanting to build big booties, which is the number one request I get is I want to build a bigger booty. Okay, there's an understanding that that's going to require weight training because you have to build muscle. So that's okay. That's in that regard, it's helping. Okay, not that I'm necessarily a proponent for big booties, but it's actually I'm a proponent of building muscle, and I think that whatever method it takes for you to understand that concept, sure.
Yeah.
And so that's what's happening. So I do like that.
Do you find that when people have like a silly goal or maybe a misdirected goal, do you find that once they start, then they start getting it? They're like, okay, no, it's a whole thing. It's not just.
I spend a lot of time if I choose to speak to someone like that. So, for example, I get today I get leads that come into me, people who are interested, who request information from me for a trainer, and I look at their interest and their goals. And one today was, I want a trainer to help me rapid weight loss. Okay, but I only want to see the trainer once a month. That's not someone I'm going to reach out to.
Sure.
Okay, because honestly, it's a waste of my time, because by the time I explain to her how it works and give her a lesson in physiology and whatnot, I could have helped 3 other people.
Yeah.
So it's not that I don't want to, it's just I simply don't have the time to be convincing people of the error of their ways.
So that's the real issue is like they're fixated and there's nothing you can tell them that's going to clarify it.
She wouldn't have believed me anyway, frankly.
She just kind of I want the cheapest, fastest.
Shortcuts.
Yeah.
Which don't exist, And
it's misinformation too that they get from other people, like, oh, you can lose weight with just once a week or once a month. Like, it's consistency. It's got to be consistent. It's got to be concise. It's got to be to the point. A lot of people don't want to do that.
And it takes time. It takes time.
And discipline.
Yeah, and discipline. You'd be working at the gym and someone, hey, will come to me yesterday. Oh, how long did it take for you to get like that? 10 minutes. What do you want me to say? There's no answer to that. I've been doing this for a long time, but I've been up, I've been down, I've been bigger, I've been smaller, I've been leaner, I've been fatter. You just keep doing it.
All they're really saying is it going to be longer than I'm willing to think about it?
Brilliant. That's exactly it.
Because if it's going to be like 7 months, okay. But if it's like 12 or like sometime next, I don't even know if I want to next month.
And that's what I say to them. My response is forever.
Yeah.
It's forever.
Yeah.
Because it's not something you're going to do and then stop. You're doing it forever, which I've actually had to have that conversation with people saying, I just want to work with a trainer for 2 months and then I'll be fine. Okay, are you going to continue working out afterwards on your own? No, I'll be finished. I've accomplished my goal and I don't need to work out after that.
Yeah, it's with like weight loss, and it's like anything. It's like, okay, I want to lose 20 pounds. Okay, I lost 20 pounds. And then they stop doing what they did to lose 20 pounds. It's like, well, I already hit my goal. It's like, well, now you're going back to what you're going backwards now.
Yeah, it's retrograde thinking. It doesn't make any sense.
Yeah.
But that's, again, I can't blame the typical layperson because they, as you were saying, Neil, there's so much misinformation and they're being bombarded with constant mixed messages from, used to be Oprah, and then it was
Dr. Oz.
Dr. Oz. Oh my gosh, Dr. Oz. And then all these other people, and now Instagram and YouTube, and I'm going to Google how do I lose weight, and the first thing that's going to come up is an ad for some supplement, some herbal supplement that was banned, but whatever. So there's a lot of confusion.
Would you say education of personal trainers is like where you start to kind of correct this misrepresentation?
I want to say yes.
Why wouldn't you? or do you have a better answer?
Yeah, I think where it needs to begin is with our physicians, our primary care physicians. Yeah, exactly. And it's just, okay, so I spent a number of years as in the pharmaceutical industry as a rep. So I understand, believe me, I understand that side of the business very well. But in my career, I often run up against, I was talking to my mother-in-law the other day. My doctor said the best exercise is walking. For what? Just the best exercise. What are you talking about? For who? He just says okay. And she would not, and I remember I said to her, listen, I'll get you some bands and I'll show you how to do some exercises, and I can send you some videos you can follow along with, and that'll be much better for you because it can make you stronger, it'll make you better, and you already have a hard time walking, there's some orthopedic issues. Okay, and then she went and bought a treadmill.
Yeah.
Okay, why? Because her doctor, whom she's known for 30 years, told her, and that her MD, I should say, her GP, told her that. And this is what I'm saying is that we have these primary healthcare practitioners whom really don't know anything about fitness
or health,
they're illness specialists,
they're disease specialists,
disease management specialists or symptom management specialists, and I understand that. Again, I was part of it as in pharmaceuticals, peddling these drugs to keep people sick, but able to function. Symptomatic relief, and but specifically fitness, and it's very frustrating. I always say, I'll accept your physician's exercise advice if he or she is willing to accept my medical prescriptions. Of course not. I'm not qualified, but neither are they.
Yeah.
Right. And this is the thing. But again, because we've created this environment, this culture where the GP is the end all be all,
the top of the pyramid,
top of the pyramid in health. Here we go.
But a lot of people, we're blaming them kind of, and sort of rightfully so, but people want that. They just want, I'm just going to ask my doctor because it's just easier, and I kind of know what the answer is going to give. Because if doctors are saying, well, I'm going to give you a prescription for exercise, you're going to meet with a trainer twice a week, you're going to start doing this, you're going to start changing your diet, they're going to be like, oh, no, I'm okay now. Don't worry. Because they know they're going to get the easy answer.
Yes.
Walking is the prescription that I don't really care. I'm going to just tell you to walk because you're going to leave and you're going to feel like, oh, okay, well, walking's good. I walk up, I walk down. That's done. But it's not an answer.
Oh my gosh, you're so right.
A lot of people just want to have that easy answer. So it makes it easier for them not to have to work hard.
And
it takes responsibility. You know, when you're given an answer like that and you accept it, you've absolved yourself of any responsibility to do anything that actually works, right? So you mentioned prescription for exercise. So there actually is an organization called Prescription to Get Active, and it's out of Calgary, and it's Steve Waterman. Not, oh my gosh, why am I blanking on his name? Oh my gosh. Scott Wildman and Perry Cicciarone are big. They're running it. They're really pushing it hard, and the goal is to get physicians on board with this organization and facilities who offer a service of exercise, and the physician will actually give an actual prescription for exercise. They go to this pre-approved facility for exercise. It's been almost impossible for them to get traction.
Well, you know why? Because if I give a prescription for medication, and so I know that I've kind of checked that box. Yeah. You have a cholesterol, Lipitor, Crestor. If I'm going to say, okay, you're going to cut down on this, you're going to start working out, you're going to go, I'd like to see. Now it's like, you're passing off the buck a little bit. Like they're doing a handoff. It's like, okay, I'm your primary practitioner, but now you're going to see someone else that actually is the expert for this. But I don't know if you're going to do it, and I'm not that person that's in charge of it. Whereas I just rather give you a prescription. Yeah. And I don't even care if you don't take it. Just bring it, just fill it, put it in your cupboard. I don't care, but I did my job.
Yeah. I think you're right. I think that's a massive component.
So there's that dismissive component. It's like, well, I don't respect exercise and diet enough to make it like the solution. And there's this, like, it's hard to teach an old dog new tricks, right? Yeah, so that profession is evolving, and it's becoming more of like, either it's just a right away prescription, or it's a referral to another person that, like, okay, another practitioner that is on my team.
Yeah.
And then that's it. Like your doctor, like, I mean, growing up and the previous generation, your family doctor was your family doctor for life. They brought you into this world, and until, as long as they're alive, maybe you outlive them, but then you find someone new. But I mean, I think that now we have all these subspecialties and different professionals and practitioners. Like, the conversation is, you guys need to communicate more. You need to be on the same page. You need to kind of share your knowledge base. And I'm like, a lot of that's true, but a lot of that's like, but people have to be smart. They kind of need to know who to talk to. They have to ask
questions.
Yeah. And it's like, hey, you know what? I noticed that you lost like 20 pounds and you're looking good, and you're eating. It's not like you're starving. Like, what are you doing? Yeah. And then they're like, I go to see this guy, and you should see him. I mean, it's that word of mouth, and it's like a tangible, like, I know you through this person. You help them, so can you help me?
And this is the point. I think it as professionals. So there's two parts to this. One, we want physicians to be more, not responsive. We want them to be more appreciative of exercise and exercise professionals. But what that means is exercise professionals need to be better, okay? Because the standard of what trainers are today is not good. So I can't blame physicians for, even if they were aware of it, to hand over somebody. Now, I know it's changing, and there's efforts being made, for example, the College of Kinesiologists and the Registered Kinesiologists, and they're trying to create a standard, and it is, but it's still so far away.
Well, it's a chasm, and the chasm is there because they were God, and they're not going to give that up.
No, and that's
but
right.
and that's why I shift the focus back on the individual. Like, instead of like, it's not because there's so many bad naturopaths or so many bad personal trainers or whoever. It's because people just, if they hit a wall and the wall is 1 inch off the ground, they give up. So it's like, if you go to a naturopath and they're like, you know what, they didn't help me, or they're kind of weird, or I didn't really have a good vibe. then they just turn their back on natural medicine. And it's like, well, shame on you, because maybe that wasn't a good fit. Maybe you weren't ready to hear what they had to say. Maybe you need to talk to someone else. You want to exercise? Well, it's too hard. Well, I mean, it's not going to be easy. You should challenge yourself. The fact that you haven't been challenging yourself is how you got in this position in the first place. People have to take that onus, because if they're not willing to say like, okay, I'm going to commit to this. I'm going to sign up, or I'm going to take these pills, supplements rather. If you're not willing to make that level of commitment, stay with your family doctor and just take your meds, because outside of that, you don't want more. Yeah. You're content. Yeah. And that's sad. It's very cynical, but it's like, but if you don't want more, then it's the industry. All the industries don't have to change to make it that much more sexy for you to want it. Like, you just have to kind of like say like, okay, you know what? I need to do this.
Yeah. Yeah. You have to be fed up you have to be fed up with your situation to start doing something different. Like, I mean,
you can't like bottom.
Yeah.
You hit the bottom. Like you're just gonna stay there? Well, okay. Well then, but then don't cry after.
Exactly. Yeah.
But there are people who do that.
Yeah.
Yeah.
There are people who willfully choose, right? They willfully choose to keep themselves in that position, knowing. I have a saying: ignorance can be cured, one time. After that, it's just stupidity. Okay, that's what it is. And people are willfully choosing stupidity because they know what they need to do, because they've been told by multiple professionals or multiple people, and they're still choosing not to. Okay, that's a choice. You're entitled to make that choice, but make no mistake, it's a stupid choice. And yes, I am judging you, 100% I'm judging you on that, because you're now putting yourself in a position where you're going to get ill, you're going to eventually be a burden on the system, and we're going to have to take care of you because you're not willing to take care of yourself. And that brings up a whole bunch of other issues related to fat shaming and body image, and what's the latest thing of positive body image and stuff like that. And I have major issues with that.
I think that's just meant to sabotage people.
I think it's meant to make everybody. It's that whole everybody's a winner mentality. No, not everybody's a winner. It's impossible. And if you're choosing to be that way, that's great. But understand, you're going to be a burden on the rest of us.
Well, there's consequences.
There's consequences to that choice, 100%. Yeah. And it's not good.
Yeah.
It's not good. But that's why I can't get behind that. And, it's not because I want to hurt or ridicule anyone. That's not the point. But I just have a real issue with this idea that we have to, be beautiful at any size. Sure. Because beauty is in the eye of the beholder, that's a subjective thing. But you're not going to tell me you're healthy at any size.
Yeah, I think that's the differentiation. It's like, yeah, you're beautiful, but if you want to be healthier, or if we're just having a discussion of what is health, like there are parameters. Like you said, we look to the science.
Yes.
Because medically speaking, like if you're above a certain BMI, you have disease risk factors in body fat, this level. Now, we're not saying that you're not a beautiful person, but let's get over that.
Yeah, let's get past
It's like,
that.
if you want to be healthy, there's a method. And if you want to, it's available to you. Yeah. No one has to be a professional bodybuilder to be healthy. But movement, like the basics of life, whether it's oxygen, sleep, sufficient calories, and movement, if you're not doing those, you're going to eventually die of a disease. And we don't need, none of that is supplements. None of it is like insane dieting, or I didn't even say exercise. I just said move. The stuff that, like, we have a body. When someone is sedentary for 14 hours of the day and they're eating actual garbage, like if you leave that food in air, exposed to the air, in 5 years it looks exactly the same, then you're wondering why you're not feeling good.
Yeah.
I mean, that's a problem. You don't even know what you're putting inside yourself. You don't even know how the body works.
Yeah, that's feeding and nourishment are two different things.
Yeah.
Or nourishing, that's two different things. You mentioned movement, and I remember a story years ago about Richard Simmons. Remember Richard Simmons?
Oh yeah.
Dancing to rock.
Sweating to
the oldies. That's
Yeah.
it. Sweating to the oldies. And there was a testimonial of one of his people who bought his videos. And I remember her saying she was too big to stand up. She was bedridden because she was enormous, beyond morbidly obese. And but she would put the videos in and she would just clap. And that was enough to get her started.
Yeah.
Because that was enough, because she has these massive arms, and that was enough to get her burning calories.
Sure.
And it started from there. You know, again, she wasn't up and dancing and sweating and, bounding around the room. She was simply clapping her hands to the beat. Everybody starts somewhere, you know, and I respect and admire people who do that. Yes, they got themselves in that mess. Okay, there's potential issues. Yes, we understand there's hormonal issues, cellulitis, and some other potential endocrinological concerns that would lead to that. But for the most part, people get like that, it's self-inflicted. Sorry, and I also my emotional trauma and whatnot. But again, there's choices being made. But people who make the choice to get out of it, I 100% respect and will always assist in any way I can.
Yeah.
Because I admire that strength of character. That means I'm sick and tired of being sick and tired, and it's time to make a change. I will do everything I can.
Yeah. Those same individuals, often the medical system failed them. I mean, and we can point fingers and whatnot, but it doesn't matter. Like, too many things went wrong for them. So for them to say, like, they are taking ownership. They're taking it on for themselves to, like, I want to feel better. I know it's a huge mountain, but I want it.
Yeah.
And as soon as they make that decision, they start seeing changes.
It's a cascade, right? And we live in a world where I think, right, you started talking about it earlier when we're dealing with primary healthcare practitioners. You have to be your own advocate as well. Right? I unfortunately have a daughter who has some significant health issues, and no one knows what's going on. It's been 11 years. No one has any idea what's happening with her, specialist after specialist. But fortunately, her mother and myself, we've been very big on doing our research and studying and asking really hard questions of the physicians, not because we don't trust them. That's not what it is. It's you have to be your own quarterback. When you're dealing with multiple disciplines within the medical community and different pillars, and they don't really talk to each other. That's the frustrating part, you know? So we have to then become a quarterback, and you have to be able to say, oh, but, Dr. So-and-so said this, and Dr. So-and-so is at this forum and at this conference this month. Can we talk afterwards? And I think, what must it be like for someone whom doesn't have the kind of resources that our daughter has in terms of having us as parents who are going to do the research and is going to push and aren't afraid to speak out? Being subject to just, okay, whatever you say, doctor, and it makes me sad. It makes me really sad for these people, and it's not an indictment on any one person. I think this is what we've developed.
Yeah, we got used to that. Like, they're just whatever they say, I'm going to do.
Yeah.
And then when you learn a little bit, and I've had enough patients tell me that's like, you know what, I know I've done my research, and you find. They contradict themselves, these practitioners. And it's not to call out anybody, but it's like when you have a system that's so subdivided, I mean, back in the day, it was a little bit better because maybe there was one person overseeing everything. They kind of got to know you and they learned a little bit about everything. Now it's like you're sort of a number, and there's, you have 5-6 different people that don't know each other, and they don't know, like, now I'm focusing on this part and they're focusing on that part, and the two parts are not connected. It's like, but we know better than that.
Yeah.
And then and you learn that, and you study, and just even fundamentally, it's like, okay, the body's like interconnected, and how are they not related?
It's silly to think otherwise.
Yeah.
It's
but the system, it's just, that's the way it is right now.
Again, I understand it. Everybody becomes, not myopic, that's not the word, but everybody becomes so focused.
Yeah, it's tunnel vision.
Tunnel vision on their specialty. It's the blind men and the elephant, where a bunch of 5 blind men, and each one says, oh, an elephant is like, touching different parts of the body, and an elephant is flat because it's the ears. An elephant is like a tree because touching the legs. Yeah. And you're not seeing the whole picture. And I think that's a big problem. And I know that's been a challenge for us in dealing with my daughter's health. Because there's no one quarterback, there's no one person, and it's terrifying. Unfortunately, her mom, again, is doing a great job in managing all of that, and she's super dynamic in that regard. But it's a real problem. And again, if I shudder to think what people who don't have that kind of advocacy, that parent or friend or parent or son or daughter, whatever, to provide that advocacy, it's a real problem.
Yeah.
So, but again, now we're talking about illness management. But now obviously my daughter's case is different because she's had this since birth, literally since birth. So it's different and congenital, but the things that we can avoid with exercise, with lifestyle, with nutrition, with proper care, this is what I think we need to shift focus to as a society, as a culture. And that, I think, is where we as health and fitness professionals can have the biggest impact on the world.
Sure.
And really promoting prevention versus treatment, right?
And maybe part of it is actually getting to the young people when they're in school and really putting a premium on education in terms of health and fitness and activity, and gym not just being about okay, we're going to play basketball today. It's actually, you know what? Learn the health, learn proper movement, learn actually what your body's supposed to be doing. And I think because the culture now is to full on acceptance of everything, we actually are masking signs of poor health and disease when it's showing up early, whether it's school lunches or inactivity or sedentary lifestyle, whatever it is. And that's the time when we can make the biggest impact, because then those are lifelong lessons. And maybe that's something we can aim at, is get to them when they're younger. Because then it's I remember, when I was in third grade, this trainer came in and, I wanted to do exactly what they're saying because they look great. I want to be like that.
Yeah. And I think that's a big part of it. I remember going to my kid's school in senior kindergarten, actually, and having conversations about movement and about exercise. And obviously I was talking to a room full of 5-year-olds. I wasn't telling them, okay, you got to lift weights and I wasn't saying that at all, but just getting them to move and understand how important it is to move their bodies and talking about muscles and bones and how muscles move bones.
And they love that. And they're a sponge for that.
100%. And it's, but it was the one time. That was one time I was invited to do it, Well,
I think that's why we have to make it a more of how do I get in there? Sorry, getting the message. But we have to make that some type of focus.
That's a great sound.
I think we lost one camera. I think it timed out. Well, we'll just wrap up on this one.
Sure.
I think that's where we have to aim, is just that level of education, whether it's with kids, with adults. We have to sort of keep on knocking down doors and say what you were told, what you looked up isn't going to work for you.
Yeah. And that brings it back to the very beginning, which you talked about breaking through the dogma, breaking through the myths and misconceptions. And it's not simple. It's not, what I say to people, it's not easy, but it's not complicated. Yeah. It requires hard work, but it's just the same thing over and over again. With some application of intelligence and structure. Yeah. And this is why, I get the question once a week. How do I get big? How do I hire a trainer? Oh, I don't need that. Okay, man, then stay small and fat. What do you want from me? That's what I was like. Okay,
I think you need to say it like that.
I do. Yeah. No, you have to understand. That's exactly what I say. Yeah. What do you want from me? I told you this is what I did. This is how I learned. This is what gets you where you want to be. You don't want to do that? Okay, then stay small and fat. That's your option. Either do what you need to do to accomplish your goal, or change your goal. That's it. That's all it is.
Yeah. No, I think that's good, and I think sugarcoating things.
It's ridiculous.
That's how you get fat in the first place.
Yep. Yeah. Fantastic. That was fantastic.
I think we'll end it right there. All right, guys. Thank you so much.